Hello. Happy Friday, everyone. Happy Friday. Happy Friday. So, as you can see by the screen, we're doing things a little different. I'm giving you guys a little sneak peek of NCLEX Arcade. If you haven't taken that already or purchased that review slash notebook or workbook, I should say, we're going to do a little review, which will also lead into how to answer select all little apply questions. I've done a few people that came to me and told me, or asked at least, for more information about select all the apply questions and how to answer them. Those are the top missed or the most missed questions on the NCLEX, by the way. And up until the NGN or the next gen NCLEX, it used to literally be all or nothing. So if you got all of them right except for one of them, it would still be 0 points. But at least now with the next gen NCLEX, they have partial credit. You have 3 different methods of scoring for partial credit, but at least that's a step in the right direction for you guys. All right. We had to do all or nothing, but at least, you get some partial credit. So the best way to practice and really learn and understand how to take NCLEX style questions or select all apply NCLEX style questions is by practicing them. All right. Review, and practicing. It's going to be your best friend. Okay. You can't learn from what you don't practice. So this is actually day 2 from our NCLEX Arcade. It's 6 days, 3 hours each. There are replays from when we did a 6-day live. And this is day 2, and we covered majority med surg. All right. And this chapter was on kidneys, all right, renal, this particular chapter right here. And as you can see from how animated it looks, everything within NCLEX Arcade, all of the chapters, all of the topics are reflected after some kind of arcade game. Right? You guys know I love applying gamification and active recall to really help you learn and retain all the must-know information that you need to know to pass the NCLEX. And I love doing that in a way that makes it fun so they can stick even longer and faster. Okay? So I don't know if you've ever played Kirby, the game Kirby, right? When I think about kidney, I thought about Kirby because K-I, and they're both kind of like pink. So I made this decorated renal off of Kirby. All right. So if you are ready to start, all right, this is just going to be a themed practice question round. If you're ready to get started, type ready in the comments and let me know if you are ready. All right. For those of you that are new, hello, welcome. I'm Nurse Sam, creator and founder of thenursesam.com, as well as campnursing.school.com. And I create products, reviews, study kits, courses to help nursing students learn how to retain and study in nursing school without being overwhelmed and without being so bored out of your mind that it doesn't stick. Okay, I've been doing this for 5 years. I've been a nurse myself for 10 years, and I passed the minimum amount of questions. And I've been helping thousands of nursing students do the same thing for the past 5 years. So that's what we're going to do today. Let me know if you're ready. All right, so I got a ready. Happy Friday. All right, let's go ahead and get started. Okay, first question. And once again, this is select all apply practice. So we're going to do a lot of select all apply practice questions. This one reads, what discharge instructions should the nurse provide to a patient who underwent lithotripsy with ureteral stent placement? Select all that apply. All right. Now remember, with select all apply, it can be as little as one of these answer choices or as many as all of them that are correct. So don't try to overthink and second guess yourself and try to maintain a pattern of how much you think is correct versus not correct. Don't do that. It can vary. All right. So which of these are the answer? All right. One says, if you start having a fever or chills, call the healthcare provider immediately. 2, make sure to drink plenty of fluids to help move the stone fragments out of the kidney. 3, maintain bed rest for 48 hours, only getting up to go to the bathroom. 4, your side or back may develop some bruising. Or 5, you could have pink to red urine for up to 24 hours. Remember, this is select all that apply, okay? One of the best tips that I can give for select all that apply, other than practice, all right, is to look at it as true or false. Every answer choice go through it one by one and ask yourself, is this true or false? If it's true, then it applies, right? If it's false, it does not. You want to make sure every aspect of that answer choice applies, okay? It is not correct if it does not apply. So let me see what you guys are saying as far as your answers. I see 152 or 125. I see 25. 125. Okay, so you guys are saying 1, which is if you start having a fever or chills, call the healthcare provider immediately. 2, drink plenty of fluids to help move the stone fragments out. And 5, you can have pink to red urine for up to 24 hours. All right, so majority of everyone is saying 125. So let's look and see if that is our correct answer. All right. And let me move my head. Hold on. Okay, boom. It is 1, 2, 4, 5. Close, guys. Very close. 1, 2, 4, 5. You missed one. All right, so this is where that partial credit would come into play. Okay. Years ago, before the NGN, you would have got this wrong. But at least now you got 3 out of 5. 3 out of 4. So this says 1 is correct. Fever and chills may indicate infection. So that is the correct answer. 2, make sure to drink plenty of fluids. This is lots of fluids. It's going to assist with the passing of stones and particles. So that is true. 4 was correct. And a lot of people missed 4. I think everyone missed 4. But let's look into why 4 is included. So that next time when you see it, you won't miss it again. Okay. 4 says your side or back may develop some bruising. And this is true. All right. This is correct. Bruising may be present from lithotripsy procedure. All right. Think about what lithotripsy is. If you go over up here where it says ask, problem, solution, that's a 3-step breakdown of what you can do to further break down the question to understand what it's asking you. Okay. Again, the problem that this patient was going through, lithotripsy with a ureteral stent, the waves that break up the kidney stones inside the kidney, that actual motion, I guess, can cause bruising. The procedure can cause bruising. All right. And then 5 says you could have pink to red urine for up to 24 hours. And that is true. Yes, there may be blood present from the procedure. Okay. All right. So, someone did get 4. Great job, Shabish. So awesome job, guys. If you did not get 4, that's okay. At least now you know. Now let's go on to the next one. All right. This one isn't selected apply, so let's not do that one. This one. All right. Let's do number 3. What action should the nurse initiate to prepare an end-stage renal disease patient for hemodialysis? Select all that apply. By the way, guys, if you want to get this copy for NCLEX Arcade, you can definitely do so. Plus, we have a 50% off sale that expires in less than 4 hours. So use code APRIL50 if you're interested in getting the rest of these questions. It's 200 questions, 6 videos that are 3 hours each for a total of 18 hours of video walkthrough breakdowns and 200 questions. All right. Let's get into it. What action should the nurse initiate to prepare an end-stage renal disease patient for hemodialysis? Select all that apply. Is it 1, administer the patient's morning doses of metoprolol and enalapril? 2, assess heart and lung sound and obtain present weight? 3, give subcutaneous heparin during dialysis to decrease clotting? 4, feel the fistula for the presence of a thrill and listen for a bruit. And or 5, review the patient's medical record for last post-dialysis weight. We are selecting all that apply. All right. Once again, I am your host, Nurse Sam, creator and founder of NCLEX Arcade, which you can get again for 50% off for the next 3.5 hours when you use code APRIL50 on the nursesam.com or my Stan store. All right, let me see what you're saying. 125, 124, 125, 245, 1245. Isn't this poetic? That'd be crazy if it was all that again, right? All right, let's see what our answer is. I see 245, 125, 2345. All right. And our answer is 245. 245. Ooh, great job. It's Narissa, Shabish, TT, Red. Awesome job. Oh yeah, y'all did not come to play. All right, so this says 2 is correct. All right, you always want to assess the vital signs and weight to get the baseline to compare. Okay, let's backstep. Let's look at this entire question as a whole. All right, what are we being asked? What's the problem? And then what's our solution? All right, the question's asking us for the actions that we should take. All right, to initiate preparation for this end-stage renal disease patient for hemodialysis. All right, so again, 2 is correct because you always want to assess vital signs and weight for the baseline to compare. 4 is correct. Feel the fistula for the presence of a thrill and listen for a bruit. That is correct. You want to assess the fistula to ensure it's functioning well. And then 5 is correct. Weight is the biggest thing. You always take the weight to compare because once again, weight is the most accurate indicator of fluid status. All right, fluid volume status. So weights are huge before and after dialysis. So you can compare, right? 1 was wrong. A lot of people chose 1, but this is why it's wrong. Administer the patient's morning doses of metoprolol and enalapril. You always want to hold their medications right before going to dialysis because what's going to happen at dialysis? They're going to dialyze it out, right? Exactly. It's just going to go right. It's going to go in and then go right out. So it's a waste of medication. That's why you want to hold their medications. And then 3 is wrong. It says give sub-Q heparin during dialysis to decrease clotting. No, heparin is added to the blood, not directly to the patient itself. So that's why 3 was wrong. Okay. Great job, guys. All right. Next question. All right. Third question. What nursing action should the nurse implement for a patient with overflow urinary incontinence related to spinal cord injury? Select all that apply. Okay. 1, assess the perineal area for any evidence of skin excoriation. 2, restrict water intake to the minimal amount during meals. 3, instruct the patient to limit intake of caffeine or chocolate. 4, implement a fixed voiding schedule to prevent bladder overfill. And then 5, measure any post-void residual volume as per protocol. We are learning how to study or how to answer select all that apply questions. And the best way to learn is to practice. Okay. You know the content already. This is just asking you in a different way. So the best way to practice is to do it. All right. What is our answers? Let me see what you guys are saying. Remember, this is select all that apply. So it can be as little as 1 of the answers that's correct or all of it. All right, what is our answer? This is select all that apply. Let's look at what the question is asking us, right? What nursing action should the nurse implement for a patient with overflow urinary incontinence? So again, we're looking for those actions. Which ones apply? Let me see what you guys are saying. Comment down below. Hello, everyone on TikTok. Welcome, welcome. We are just now going live. We are on our 3rd question of Med-Surg Renal. All right, let me see what you're saying. All right, so I see 2, 3, 4, 2, 4, 3, 4, 5. All right, let me see what you guys are saying over here in the comments. Comment below if you know what the answer is. All right, 3, 4, 5. Let's see. All right, and the answer is 1, 3, 4, 5. Ooh, so close, so close, so close. But again, practice makes perfect, or progress, I should say. Great job. All right, so 1, 3, 4, 5. All right. 1 says assess the perineal area for any evidence of skin excoriation. All right, that is something that you do want to do. Checking for skin breakdown is an assessment form or an assessment from the urine contact. All right. Remember, when you have skin that's always moist and always wet, it's at an increased risk for skin breakdown. All right. So you always want to, especially if they're urinary, if they have incontinence, that's a big one. Okay. Huge red flag for skin breakdown. So that's why 1 is correct. Some of you said 2. 2 is wrong. And this is why. You don't want to, it says fluid intake should be maintained. You don't want to restrict the water intake. All right. And then 3, 4, and 5. 3 says bearing down helps fully empty the bladder. So that's why 3 is correct. You want to instruct the patient to limit the intake of caffeine or chocolate. 4, implement that voiding schedule, and that helps them keep the bladder empty, especially because that incontinence is related to a spinal cord injury. Okay, it's not like they're just incontinent because they want to be, right? And then 5, measuring residual to assess retention. That's good for the patient. All right, great job. So close, so close. A lot of you only just missed number 1, but now you know, right? Now we know. With urinary incontinence, you definitely want to think skin breakdown. Okay. Next question. No, okay, right back. All right. Here's our next select all to apply question. Once again, for those of you on TikTok, this is a sneak peek and a preview of our NCLEX arcade. This is from day 2. We're covering med-surg, and the level or topic right now that we're on is renal. You can get that 50% off for the next 3.5 hours if you use code April50. But again, you only have 3.5 hours, so make sure you grab that. This reads, what nursing intervention should be included in the post-procedure care plan of a patient scheduled for a percutaneous right kidney biopsy? Select all that apply. All right, is it 1, assess the biopsy site and dressing for any bleeding? 2, assure bed rest for the first 24 hours post-procedure. 3, evaluate the pre- and post-procedure kidney function blood levels. 4, place and maintain a Foley urinary catheter. 5, maintain sideline position of affected side for 30 to 60 minutes. And or 6, check heart rate, blood pressure, and respiratory rate every 15 minutes for 1 hour immediately post-procedure. Okay, off rip, I'm going to give you a hint. Okay, another thing with select all apply questions, especially when you're looking at each of them as true or false, right? We're not looking for the one best answer. This isn't multiple choice, right? We're selecting literally all that apply. So it can be as many as, or as little as 1 of these out of 6, or many as all of them out of 6, right? And having them all correct is petty, but the NCLEX will do that. 136 from Jaslyn. Let me see what you guys are saying over here. What are your answers? All right, let's look into what the question's asking us, what the situation is. All right, again, we're looking for nursing interventions. All right, that should be included in the post-procedure care plan, all right, of a patient that's scheduled for a percutaneous right kidney biopsy. 1345, 136, 356. Ooh, all right, let's see what our answer is. All right, in 3, 2, 1. It is 1256. 1256. Let me make sure you guys can see that. Okay. All right, is that better for you guys? Can you guys see that? I think that should be better. All right. So this says 1. First, let's go into the question breakdown, right? We're looking at what we're being asked. Interventions to include the problem is the post-kidney biopsy. Anything with biopsy that's invasive, you want to think bleeding, pain, and infection because it's invasive, right? Solutions that should be done for this patient. 1 says it's correct because you definitely want to check for bleeding and volume loss. All right, again, think bleeding, pain, and infection. 2, assure the bed rest for the first 24 hours post-procedure. That is correct. That bed rest is going to promote healing and decrease the risk of complications. Okay. 3 was wrong. It says evaluate pre- and post-procedure kidney function blood levels. That's wrong. Kidney labs can be checked daily, but not right away. Okay. So it was the post-kidney function check that made that one wrong. 4 says place and maintain a Foley urinary catheter. That's wrong. All right. The patient can void on their own. They do not need a catheter. And then 5 was correct. You want to maintain that sideline position to splint that affected area to decrease the risk of what? Bleeds. bleeding, pain, and infection, right? And then 6, definitely want to check those vital signs, heart rate, blood pressure, respiratory rate. Definitely. You want to check that every 15 minutes for 1 hour. And that's typically what the post-procedure, especially if it's surgical, but post-procedure complication check rate is, right? Every 15-minute checks. Q15. And that's usually for the first hour after the surgery. And then it's like maybe every hour or every 30 minutes. It depends. But the more stabilized the patient is, the longer between those checks. Okay? All right. So, does that make sense? Do we all get that? Okay, perfect. Let's get to the next one. All right. Another question. Here we go. Remember, this is med-surg, renal level of NCLEX Arcade. What assessment findings of a patient receiving peritoneal dialysis would be a priority for the nurse to report to the healthcare provider? Select all or apply. Damn, this is priority and select all? Oof, yeesh. Is it 1, dark outflow with sediment? 2, dry, itchy skin? 3, heart rate of 120 beats per minute? Or 4, low urine output? Oh, not or 4. 4, low urine output. Or 5, a temperature of 99 degrees Fahrenheit or 37.2 degrees Celsius. What are our answers? All right, Shell says 134, which is dark outflow sediment, heart rate of 120, and temp of 99. No, I'm sorry, low urine output. That's what you said, not 5. What about you guys? What are you saying over here? 1 and 3. All right, I'm seeing 1 and 3. So everyone's pretty much saying dark outflow with sediment. Crazy says 1, 2, 4. Angelica says 1 and 3. Carolicia 1 and 3. Jasmine 1, 3, 6. All right, let's see what our answer is. All right, ready? And 135. Oh, 135. Oh, 135. That got us. That got us good. All right, let's see if anyone got that. 135. Ooh, Tita, you were close. You said 1345. Patchler, you got it. All right, let me see what you guys said. Did anybody get 135? Shells, you were close. You said 134. Jasmine, you too, 136. But did you mean 135? Because there is no 6. Let's look into what that rationale is. All right, let's look at what the problem is asking. The question is asking what the problem is and the solution. All right. So it says for 1, dark outflow with sediment that can indicate infection leading to peritonitis. 2, that heart rate of 120 beats per minute. Tachycardia can indicate infection or fluid volume overload. And then 3, the temperature of 99 degrees Fahrenheit. Increased temperature. I'm not even gonna lie to you. Okay, I understand. Since normal is 98.6, technically a fever, right? A fever, increased temperature. Mind you, this doesn't say fever, it says increased temperature. All right, let's say that. Okay, there is a difference. Fever is after, I think, actually, I don't even know what the number is. It changes all the time, depending on your program, book, whatever. But an increased temperature is not the same thing as a fever. 98.6 is normal, so 98 point whatever, or 99, that is considered an increase in temperature. And then a fever, yes, 100.4. I thought it was 100.3. It was 100.3 when I was in school. So 100.4, that's considered fever. And it depends on if you're have kids in school, what the school nurse considers fever. But on the NCLEX, right, fever is 100.4. But this doesn't say fever, it says increased temperature. So let that be. This is how the NCLEX gets us, right? Critical thinking. All right, let me see what you guys are saying. Did you get that one? Yeah, low urine output is to be expected. So great. That's why I didn't choose that one. Awesome. All right. All right, let's get to the next question. Great job, guys. All right, this is our bonus or boss level question within our renal level. All right, this is the last question that's going to get us out of the renal level. And since this is select all and apply, right, let me see if you guys can see that. NCLEX Arcade was also designed as like escape room style. So in order for us to get out of renal and to get into the next level, which I think was maternity or something, you would have to enter the correct code. And this code was indicative of whatever the answers were for the select all and apply. All right, so whatever the code is and the correct answers that you choose for which of these 5 actually apply, that's going to be the correct code and the passcode that's going to get us out of this level. Okay? So here is your question. Select all and apply, of course. Let's get into answering it. All right. Which statements made by the patient indicates proper understanding of the procedure for collecting a creatinine clearance urine specimen? Select all and apply. Select all that apply. All right, is it 1, I will discard my first urine and then collect all my urine in a container for 24 hours? True or false? 2, I will have a catheter placed with a specimen and then removed after the urine is collected? True or false? 3, I will keep my urine specimen in the container provided and on ice to keep cool. 4, I will wash my hands and provide a midstream sample in a sterile container. And or 5, the first morning specimen is best because it is more concentrated. All right. Another little hint, go through each of the answer choices and ask yourself, is this true or untrue? Okay, go back to the question and make sure it's not one of those need for further understanding, need for further teaching, reinforced teaching questions. It's not. So at least you know you are quite literally selecting all that apply and that all that are true. So go through each one and ask yourself, true or false, true or false. All the ones that true, that's your answer. Okay, let me see what you guys are saying. What's your code so far? All right, your answers are going to be the code for how we get out of here. All right, Miss Passion on IG says 135. Let me see. Ari says 3. I'm sure 3, 4, 5 is correct. I don't know about 2 and 1 is wrong. Everyone just knows that 1 is wrong. No one said 1. 2, 4, 5 correct. 3, 4, 5. 4, 5. 5 true. 1 false. Everyone's like not 1. Okay, great. At least we all know we got that right. We either all got it right or all got it wrong, right? So let's see what our answer is. Ready? And 1 and 3. It's 1 and 3. Did anybody just get 1 and 3? That's so crazy because 1. Oh, wow. Oh, wow. Let me go back. Let me do this one back up. Everyone said, I think there was one person from Instagram that got 1. And she was correct. It's actually 1 and 3. It says 1 says, I will discard my first urine and then collect all my urine in a container for 24 hours. All right, we're looking for the statements that indicate proper understanding. Okay, so for this one, the first void at the start of the day is not included. All right, it's actually not the first void. All right. 2 is wrong. Says I will have a catheter placed with a specimen and then removed after the urine is collected. This is wrong. A catheter is not needed. Patient can self-void to collect. Okay. 3, this one is correct. I will keep my urine specimen in the container provided and on ice to keep cool. Yes, urine kept in the container and on ice to maintain its integrity. Let me see what you guys are saying. Don't make me laugh, y'all. Don't make me laugh, please. It says 4 was wrong. I will wash my hands and provide a midstream sample in a sterile container. This one's wrong. It's not midstream. The full void is collected. It's just the first urine and the first 4 is not collected. You guys may be thinking about like a urine clean catch, not a creatinine clearance urine specimen. Two different things, two different procedures for collecting those specimens. All right. When it comes to the midstream, that's a urine clean catch. Like you're about to go to the doctor and they're about to check your urine for a UTI or something, right? That's a clean catch. This is specifically, right, for creatinine clearance. It's its own, like, it's like a long, like, I think it's orange. And that's like your container that you're using. You literally pee in this container all the time. And just like 3 says, you keep it in that container and you keep that container on ice. All right. So I really want you guys to make sure you understand that this is the difference between clean catch and creatinine clearance. Gotcha. Great job, PMB Jess. Great job. All right, and then 5 is wrong. It says the first morning specimen is best because it is more concentrated. That's not true. The first morning specimen is actually disregarded because it is actually considered, was it contaminated? Something about the first stream or the first void not being included. And it's not because it's more concentrated. That's probably why it's excluded. Okay. Well, at least I only got 1 wrong as region or soon fall. Perfect. Good. Remember, guys, this is all about progress, not perfection. Not perfection. I don't expect you, and you shouldn't expect this of yourself either, to just go in and get all the answers correct. If you're leaving one off, you should pat yourself on the back. You got literally all of them, but you maybe missed one. And even if you missed all of them for this question, we did like 5 questions. You got all the other 4 correct. You see what I'm saying? Like, don't beat yourself up. Don't make yourselves, and like, don't adapt the mindset like, oh my God, this is hard. It's impossible. I'll never be able to do it. Nursing school sucks. My nursing school does suck. It's hard. But that's on nursing school, not on you. Okay? You're that. I need you to remember that. Okay? All right. You guys want to do some more? This is NCLEX Arcade, by the way. Let me see what you're saying. You guys want to do another round? This one was renal or out of renal, so we can see what our next thing is. Okay, boom. Woo! You successfully defeated the renal. Let me go back to it. You successfully defeated the renal level of the NCLEX Arcade game. It looks like we're on to the next level, which is pulmonary. Are you ready? All right. Carly said, I like this. Oh, I'm so glad you like this. Again, this is NCLEX Arcade. Over 200 questions. And by the way, the fact that you guys are getting these questions is another reason I want you to pat yourself on the back, because these are not just regular questions. These are the top missed questions, the most difficult and top missed questions from the last NCLEX plan before the NGN. Okay, this is the traditional NCLEX, which is still valid, by the way. All right, the NGN only accounts for a small portion of the NCLEX. The rest of it is the traditional NCLEX. So these are the top missed questions. So if you are performing well, if you can get through the 200 questions on NCLEX Arcade, please best believe you're off to a great start, because you just went through 200 of the top missed, most difficult questions for both RN and PN NCLEX. You're welcome. All right, so were you guys ready to go to pulmonary? Were you guys ready to go to pulmonary? Red says, how to purchase this one. I did this the school packet, but not for NCLEX. This one, you can get it either by itself or part of NCLEX Arcade, or, and this is what I recommend, utilizing the 50% off code and getting the complete nursing school study system, because it contains everything. It contains the alternate nursing school bundle, contains NCLEX Arcade. It contains pre-nursing ATIT study bundle, first semester bundle, all the study guides within it, fundamentals, all the study guides that's within it. So if it's available on our website, Pharmacology Game Night was added to it. It's everything in one click, one bundle. And if you use the 50% off code, which is April 50, by the way, that expires in like 3 hours. So I highly, highly, highly suggest you get on that so you don't miss out. April 50, thenurseham.com. the complete nursing school study system. You will have everything in there. Okay, you will not have to go back and be like, oh, did I miss this? No, it's in there. Okay, you have the planner and all that. So go ahead and grab that so you can take advantage of both the workbook, which has all these questions and the rationales, as well as the video walkthrough, just like what we're doing. Okay. What's the total for that? For that one, the complete one? The total, regular total without the sale is $89, which is already a discount because everything included. The ultimate bundle is $59. Let that sink in. The ultimate bundle is $59 and the NCLEX Arcade is $39, but both of them are contained in the complete study system with everything else, and it's only $89. Plus another 50% off. So it's $44.50 for the next 3 hours. $44.50. All right, let's go ahead and get into our next question. All right, and this was Pac-Man. Again, this is pulmonary. Remember, I am creative and I love to gamify everything and make it interesting, fun for better retention and longer retention. Remember, this is NCLEX Arcade. So, of course, pulmonary just couldn't be pulmonary. It had to be arcade related. Pac-Man. Duh. So now let's go ahead and get started with our first pulmonary question. And again, we are learning and practicing how to answer select all apply questions. And the best way to do that is through practice and repetition. Okay. Boop, boop, boop. Let's get into this one. This says, which actions by a graduate nurse indicates that additional teaching is needed regarding care of an intubated patient on mechanical ventilation? Select all that apply. Is it 1, administers IV lorazepam 1 milligram to help the patient's restlessness? 2, activates suctioning while placing the catheter into the airway. 3, pre-oxygenates patients and increases oxygen during suctioning. 4, suctions endotracheal tube for at least 20 seconds per pass. 5, suctions patient when the high pressure alarm is sounding. And then 6, suctions patient when rhonchi and visible secretions are present. That was a lot, wasn't it? That was a lot. So usually select all apply questions are about 5 to 6 answer choices. Of course, when you get into the NGN and you get into the expanded ones, that can go up to like 10 different options. But again, you only have a certain number of those. So for the majority of the select all apply, which is the majority of the NCLEX, you'll have about 5 to 6 answer choices. And again, go through each one and ask yourself, is this true or is this false? But make sure you are reading the question first and going back just to make sure it's not one of those needs further teaching, needs additional teaching, all that great stuff. And in this case, it is. So when you have something that says, indicates, which actions indicate that additional teaching is needed, further teaching is needed, further education is needed. That's letting you know that you're looking for the false answers. Okay, so still go through each one and ask yourself true or false, but you need to remember, you need to remind yourself so you don't get confused that, okay, I'm looking for the false answers. Is 1 true or false? Is it true? Is it false? If it's false, then yes, that's the one that I'm going to go with because that's what the question's asking me. All right, so Aisha says 245. Activate suctioning, suctions endotracheal tube for 20 seconds, suctions patient. Let me see what you guys are saying over here. 1, 2 false, 2, 3, 4, 2, 3, 4, 5. All right, let's look and see what the answer is. You ready? It is, move ahead. 2, 4. It is 2 and 4. It is 2 and 4. Okay, let's get into why it's 2 and 4. Oh, great job, Via. Yes, Via. Yes, Evelyn. Aisha, you was right there too, boo. You just chose an extra one, and that's okay. Unknown, you're right there too, because you got 2 and 4. You're not wrong all the way, right? You just picked some extra ones, but at least you got 2 and 4. You knew that those were false, which means you knew that those were true for this question. So, claps to you guys. We gotta We gotta keep up with our small wins, okay? So let's dive into why it was right versus wrong, okay? Again, we're looking for the action that indicates the need for additional teaching. So we're looking for the false thing. So 1 was wrong, okay? Administers IV lorazepam 1 milligram. It says lorazepam is used for restlessness and it's appropriate since it will help the patient prevent them from fighting against the vent. Okay, so this is actually a true action, which is why, actually, let me bring this back up because you guys can't see. Oh, okay, cool. All right, perfect. Yes, so this is a true statement, which is why it was wrong. Okay. 2 says, this one was correct, which means it was false. This activating suctioning while placing the catheter into the airway, that's what you don't do. You don't do that, which is why it was correct. All right, this is definitely going to indicate the need for further teaching because no, suctioning on the way out is not the way. Suctioning out on the way out, not on the way in to prevent hypoxia. Okay, you want to suction on the way out, not way in. 3 was wrong, which means it was right. You pre-oxygenate before suctioning, okay, and that's appropriate to prevent hypoxia. All right. And then 4, this one was correct, which means it's wrong. You don't do this one. It indicates the need for further teaching. All right, you do no more than 20 seconds. Right, Evelyn? 20 seconds is wild thornberries, okay? No more than 30 seconds. I'm sorry, no more than 10 seconds with the suctioning, and that's gonna prevent hypoxia. Think of your ABCs. Remember, this is respiratory, so almost everything's gonna be with the airway. All right, and then 5 and 6 were wrong because they were correct. 5 says high pressure alarms can indicate occlusion or something jammed up against it. So that's wrong, which means it's right. And then 6 says suctions when secretions and fluid is in the airway. That's appropriate. Remember rhonchi, right? When you see the word rhonchi, do you think, well, no, I'm just going to let you know. With rhonchi, I want you to think that as an abnormal lung sound. With crackles, it has fluids. And with rhonchi, you have phlegm/mucus. Okay, so whenever you see rhonchi, I want you to think about mucus. That sound, the abnormal lung sound, is being caused by the mucus. So that is an appropriate indication for suctioning. All right. Let me see what you guys are saying over here. All right. Does that make sense? Are you guys learning a lot? Do you enjoy this? Do you want me to go on to the next question? I just want to just make sure that not only are you practicing your psychological applied skills, but you're also understanding and grasping why answers are right and why answers are wrong. Okay? Vacuum when it's viscous. Evelyn, I love that. I love that. Okay. Make sure you guys are double tapping this live, share it, tag a friend, and if you want me to go to the next question, drop a thumbs up in the comments so I know that you like this content so I can continue to make some more and we can continue to go live doing more of these. All right. But I just want to check your temperature really quick and just to see how you're feeling. Are you learning something? Did you learn something new? What about you guys over here? How are we doing over here? Let me see. Okay, thumbs up, thumbs up. Question, is the material in the complete guide valid for California students? Absolutely. It's everybody in the US. All right, next question. We're going to stick to the select all applies for this round. And then when we do, of course, we're going to do all the test taking strategies. So when we dive into priority questions, we're going to do even more. But I want to stick to just the select all apply. And this is going to be our last one for the evening. I'll be back live tomorrow going over some more questions. But this question reads, which clinical manifestations is/are consistent with the diagnosis of obstructive sleep apnea? Ooh, a select all apply. Is it 1, feeling overly sleepy during the day? 2, difficulty being awakened? 3, headaches upon arising? 4, loud snoring at night. 5, observed episodes of apneic periods. And or 6, orthostatic hypotension. Okay. What is our answer? And another little side note, when it comes to med-surg, by the way, I know this is day 2, right? NCLEX Arcade, which is our med-surg chapters, and we just have different levels. We're not renal, now we're in respiratory. When it comes to med-surg, no matter what the chapter is, expect to see a lot of the questions that are selected to apply be geared towards clinical manifestations, signs and symptoms, as well as, the correct versus incorrect nursing actions and interventions, right? Those are very popular. So those 2, especially with things like endocrine, oh my gosh, please. So let me see what you're saying. 145. Remember what the diagnosis is. Obstructive sleep apnea, okay? You guys are saying 1, which is feeling overly sleepy during the day, right? That's from poor sleep quality. 4, loud snoring at night, of course. 5, observed episodes of apneic periods, hence why the name is literally obstructive sleep apnea. And then 3, headaches upon arising. Why would headaches upon arising be a maybe? This is good. Let's see what our answer is. It was 3. I wanted you guys to get it so bad, but the fact that you guys kind of pointed it out, Evelyn, I saw that you did it. You were like, maybe 3. You knew it was 3. You knew it was 3. But again, once you take more, the confidence, okay? So it was 3, the headaches upon arising, and that was because, all right, it's common from the lack of O2. Remember those periods of apneic, all right, sleep, lack of oxygen. Okay, the reduced oxygen during the sleep is going to cause headaches, common when they rise, okay? So 1, 3, 4, and 5 were all correct. That feeling overly sleepy during the day, once again, because of being disturbed at night from the obstruction. Number 2 was wrong, difficulty being awakened. They're actually easily awakened. They're not going into a deep sleep, so, they're not gonna take hours to be awoken. 3, headaches, we just talked about 3 headaches. 4, loud snoring at night. That's from the obstructed airway. That's like one of the common, most notable signs of obstructive sleep apnea. 5, the observed episodes of apneic periods, the apnea from the obstructed airway. And then 6 is wrong, that orthostatic hypotension. That's not sleep apnea. It's typically from like low fluids, dehydration, something like that, but not from sleep apnea. Okay? Come on, Evelyn, with the definitions. All right, central sleep apnea is when the brain forgets to breathe and only resumes once CO2 builds. She's giving you knowledge, all right? How are you guys doing over here? 2, 4, 5, 1, 3, 4. Great job, Jay. Great job, beautiful. Awesome job. Let me see what you guys are saying. Evelyn got that one. Okay, perfect. All right. Make sure we all understand why that one was what it was. Okay, last question. I promise. And then we're going to resume this tomorrow, I promise. But I'm going to ask you guys what chapter you guys want to dive into after we do this question. Okay? Which topic should be reviewed for a patient recently diagnosed with cystic fibrosis? Select all that apply. 1, the importance of a low-fat diet to maintain a healthy weight. Is this true or false? This one has 6 answer choices. So I recommend you can read all of them all the way straight through and then go back through, read the question one more time. All right, just to make sure it's not a true versus false, need for further teaching type thing, and it's not. And then go back and one by one ask yourself true or false, so you don't get confused and you don't confuse yourself. Okay. 1, the importance of a low-fat diet to maintain a healthy weight. 2, the importance of taking modafinil at bedtime. 3, the importance of an exercise program to increase lung capacity. 4, the importance of using postural drainage to help loosen secretions. 5, the importance of fluid restriction to reduce the risk for heart failure. And 6, the importance of limiting caloric intake to reduce sticky secretions. Another tip for you guys when it comes to select all and apply. Really with any NCLEX question and answer choice, but especially for select all and apply, you want to make sure every aspect of that answer option is true. Okay? For example, number 2, the importance of taking modafinil at bedtime. You might just stop at modafinil and be like, oh yeah, modafinil. But that at bedtime, that's a detail that isn't just thrown in there randomly, okay? So just pay attention to your adjectives, pay attention to your descriptor words, and anything in there that's either specific and in addition to, right? If you have 2 parts, then both parts have to be true. All right, 3, 4, 6, maybe 1. Oh, definitely bedtime is insane. Let me see what you guys are saying. 1, 3, 6. Lois is 1, 3, 6. What day will you do priority questions? I'm gonna ask you. I'm going live every day this month, so we'll be live every day, except Sundays. 4 and 6. All right, let's see what our answer is, guys. 3 and 4. 3 and 4. Ooh, that one was good. 3 and 4. Evelyn, you did get 3 and 4. You did an extra one. I don't count them every one. Illinois, you were so close. You got 4 and 6. You missed 3, but you got 6 instead. And then what about you guys? Lola, you got 3. So let's get into why it was 3 and 4 and why it wasn't the other ones. All right. So again, the question's asking us the topics that should be reviewed for this recently diagnosed CF patient, cystic fibrosis. Okay. So with cystic fibrosis, I want you to think just mucus. All right, lots of mucus. And when it comes to the instructions that we're going to provide to this client, that's exactly what we're getting into. 1 says the importance of a low-fat diet to maintain a healthy weight. This is wrong. The need for a high-fat diet. Okay, let me bring this back up so you can see. It's the need for a high-fat diet. Okay, that's what's recommended for higher energy. Okay. Again, remember when I said pay attention to your descriptor words? Pay attention to those adjectives. If you see something that's low anything, hypo anything, maybe high anything, understand that there's a very high possibility that the NCLEX is not trying to trick you, but just trying to test your knowledge to see if you know that like it's low fat, it's high fat, not low fat, or it's, the opposite of whatever one had told you. Right? So just an example. 2, the importance of taking modafinil at bedtime. Yeah, modafinil is just taking during the day. So do you see what I mean? But they said modafinil, which is correct. But at bedtime was the no. It's not at bedtime. It's actually during the day. The opposite. Are you picking up what I'm putting down? You feel me? 3, that was correct. The importance of an exercise program to increase lung capacity. All right. Exercise will help with lung expansion, and that's thereby going to decrease the mucus stickiness. Okay. That's what you want to do. 4 is also correct. All right. The importance of postural drainage. Postural drainage helps move out those sticky secretions. It's going to help them breathe. Remember our airway priorities, ABCs, especially with respiratory disorders. Yeah. And then 5, the importance of fluid restriction to reduce the risk of heart failure. Remember, fluids actually loosen mucus. So fluids are actually encouraged, especially when there's a lot of thick mucus secretions like you would find in a CF patient. So fluids would not be restricted. It would be encouraged. Okay. And reduce the risk of heart failure. What? Nowhere in the question did they say anything about heart failure, right? If it doesn't say it, don't apply it. 6, the importance of limiting the caloric intake to reduce sticky secretions. Negative, ghostwriter. You need more calories for more energy and nutrition. You don't need less, right? So you see why? I think if you misread the question as CHF instead of CF, you would pick 5. Evelyn, I'm so glad you said that, because then that goes to my next point. Always make sure that you are rereading the question and at least taking your time, pacing yourself. I'm not sitting here and saying like, which topic should be, I'm not saying do that, but be intentional about pacing yourself so that you don't just quickly read through the question, read through the answer choices, because that is how you miss key information on content that you know and you get it wrong. And I don't know about you guys, but it pisses me off way more if I know the question, I know the answer and the content, but then I get it wrong because I misread a word or I was going too fast and I missed something just so obvious there. Like, it's like the worst, right? I'd rather miss it because I don't fucking know it, right? I'd rather miss it because maybe I missed that chapter, but not because I know this and I was just going too fast. But that happens more often than you think. You know the content more than you think. I've been doing this for 5 years, thousands of nursing students, okay? Thousands of nursing students I've helped through nursing school and passed the NCLEX, both RN and PN, traditional and next gen. The problems are all the same. You guys know the content. If you're getting through nursing school, I promise you know the content. You just don't have enough practice of the strategy. You just need to practice applying the strategy. And the best way to practice applying it is practice questions, right? But who wants to study alone? Who wants to study alone, especially when you don't know what you're doing? That's where I come in. Okay. If you guys want more of a guided way to study, a guided plan on what to focus on, and exactly how to break down these questions, you should join Camp Nursing School. Okay? Yes, having all the study materials are great, and it's going to be great. No fluff material that's you're definitely going to be tested on in the NCLEX. But if you don't know how to apply the information, it's not really going to do you any good. All right? And I don't want you guys just to buy up all the study materials all over Etsy and TikTok, but don't know how to apply them, because the only person that's going to suffer is you. All right. I want to make sure that with whatever textbook you're using, with whatever learning style that you are, however you like to say that works for you, you're able to do so in a way that actually shows that you're studying effectively. You're studying the right content and you're using the right strategies. And we're going to focus on both of those, especially the strategies, in Camp Nursing School. You just need somebody to do it.